Hi, welcome to our new interview in the People Power Health series. I'm Sam Gonzalez, and I'm very happy and very excited to meet with Dr. Gaurab Basu. He is joining us today to have a conversation about a little bit about his life, his career, and his journey into health activism. So I would like to ask you, Doctor, how would you introduce yourself with someone that you just met?
Yeah, that's a great question, and thanks so much for having me and for all the great work you all are doing. I think a lot of my family probably comes to my mind first when I introduce myself, and so my family is very important to me. They worked really hard as immigrants with very little to make their way in the U.S. after growing up without great resources in India. My grandparents there who had even less. And so I think, I certainly feel a lot of privilege and a lot of, responsibility that the sacrifices and work that they took on so that I could have the opportunity to fulfill my passions and hopes is certainly directly tied to my ancestors and all they did to put me in this position. So with that being said, I'm a primary care physician. I work in a community health center, the Cambridge Health Alliance, and I run a center there called the Center for Health Equity, Education, and Advocacy. And so I would say that, my interests are probably in three different realms. One is in primary care. I love taking care of my patients. I really enjoy health equity education, teaching, so both through the center and through the med school and public health school. And my personal advocacy work has been in climate change. And my background's in global health and human rights work. And really, those are some of the frames that I bring into the climate work I do.
Amazing. And I would like to start this conversation asking you, when was the time where you took the decision that you will be getting enrolled with healthcare? So yeah. When did you decide I'm going to be a health professional?
Yeah. When I was in my college years, I was a very cerebral college student. I was thinking about the world a lot and really trying to figure out, I felt like I was understanding that there was a lot of needs in the world and really feeling overwhelmed and understanding how I can be of service. And I was thinking about teaching a lot. So to be a teacher and maybe get into education policy and things like that. So one summer, so I was probably 20 years old. I spent a summer in Baltimore working on at a health literacy camp for 7, 8-year-olds. And so me and one co-teacher were teaching, this class of 20 kids, and I just loved them. It was in Baltimore. All my students were Black, and I still get very emotional when I think about it because I just adored those kids. And I just cared about him so much, and it was a summer of awakening for me, of recognizing structural injustices, structural racism, how challenging it is for communities of color to have vibrant communities that enable and manifest all their skills and abilities and dreams. And I realized I wasn't a very good teacher. Number one, that our kids kind of ate me up in the classroom, and I could not keep a disciplined class. They were always playing and throwing airplanes and all that kind of thing. But I was playing with the idea of medicine, but I wasn't sure, and one of my kids was diabetic. And so I had this job of checking her finger stick at lunchtime and one other time during the day. And I, as I remember it, they were higher than they should be, and I was worried. And there was just there was something about that, the idea. And again, I was not very well, trained or understanding of things at that point. But I remember the feeling of, if this child's health is at all, it is not acceptable that this child has anything but full health and access to healthcare. And it was it hit me in my soul, I would say. It really hit me that there's, talking about people's health is about their humanity and seeing them And that really shook me, and that made me realize I wanted to develop clinical skills and take care of people as a doctor.
Okay, thank you. Now that connection that you just mentioned about health and the humanity, I think that's very interesting, because that allows us to see how health goes far beyond the clinical part. It goes far beyond a hospital or a drug or a clinician. And as you were mentioning, for example, your work with climate change.
Yeah.
That's not something that a lot of people would immediately connect with.
Yeah.
So my next question for you is, how or when was that connection done between your interest in health and then this passion about climate change?
Yeah. No, I mean, I would say it was, so I love taking care of people. I love sitting with them. I love journeying with them. I love learning their stories. And, ultimately I want a world in which we're taking care of each other, truly, truly taking care of each other, seeing each other and caring for one another. And so medicine at its best, which it's often not, at its best, that's what it is. But it was from that moment. I mean, it was from the very beginning that I realized that it's not enough for people just to get really sick or really hurt or really harmed, and then we give them medicines. I mean, that's an amazing thing that we have so many medicines that we can improve health, and so many situations. There's situations which it's unavoidable that someone would need medicine, but there's so much that is avoidable, and that I think from that summer on, I told you when I was 20. I was very drawn to understanding that structures and systems matter a lot. History matters a lot, that all these ingredients to create health was so powerful of deciding who's healthy, who's sick, and that it never made sense to me that you simply wait until people get sick and don't think about any of this kind of more structural stuff. That people need to decide what kind of work they want to do. There's full-time doctors who are in the clinics who are amazing, but I think we all should be thinking about and understanding how our work ties into these broader structures. For me, I've been really interested in working at that structural level and at the clinical level. And climate change, I had a wake-up moment in 2018 with there was a big UN report that year. I mean, my background's in global health and human rights work, so I had worked on child nutrition and rural village healthcare in India and Liberia, but I don't think I totally appreciated how climate change turbocharges a lot of these global health inequities, and how it redistributes fairness and justice, against poor communities around the world, communities of color here in the U.S. and around the world. And so that was, in some ways, the biggest structure you can think about, a planetary structure, a planetary system. And I guess the reason I think the ability to do just work, the ability to create equity and fairness, if you can make the systems right, if you can make them healing, if you can make them produce health for everyone, it's just always felt so potent, and that the feeling that we're not going to get there unless we take on these bigger structures has just been always very activating to me. And so, yeah, that's how this kind of guided my work in various projects, and most recently in climate change.
Okay, and just a moment ago, you were talking about how maybe some health professionals decide to remain on the clinic, but others will also take a look into more structural level of impact. And we can definitely relate to that on People Power Health, because we are focusing on how can healthcare professionals decide to go into health activism.
Yep.
And I would like to ask you, do you consider yourself to be a health activist?
Yeah, I mean, it's active, like what we need is like justice that's born out of love, that's born out of that identifies and does not look away from unjust systems. Like justice is at the heart of love. Justice is the love of health. And we have the opportunity to do a lot of good, to be ambassadors of a healthy world. COVID has reanimated so many of these stories. This virus kind of followed all these fault lines of inequities in society, and had just profound and tragic manifestations, right? Because our public health systems, our equity systems, were allowing this disease and pandemic to play out so differently in different communities. I really, have learned a lot from People Power Health. We work with you all very closely because organizing is about a power analysis, knowing where power is and where it's not, and asking why and how come. And I think that you can't get to the heart of some of these issues without understanding the power dynamics and speaking to them. And so that's why, the other thing I'll just say is that it's been my experience that so many health professionals know that we've got to make change, that we've got to make structural change, but they feel overwhelmed because the problems feel so big and they're so busy doing their clinical work, that I think the work that you all are doing is really important, because I think it has to start from a place where health professionals feel fully fulfilled and feel like connected to their values and feel like they're developing the story of their lives of who they want to be. And a lot of times the way we work prevents us from doing that. So building community, building organizations and relationships that allow us to identify these problems and work together, I think is the only way to do it. And when you have a real pedagogical framework and craft to it, that's when you can be really effective, and really do it mindfully and thoughtfully, of building that community and power.
Exactly. Thank you for that. And just a moment ago, you were talking about how justice is born out of love, how all the health equity that we are aiming to achieve is mostly rooted in organizing our communities. So I would like to ask you, Doctor, if health equity is something that we can all aim to achieve and to be able to arrive there together, considering, as you just mentioned, that the pandemic has made very clear different power imbalances and inequalities all across the world, all across different systems. So what else can we think about achieving this health equity in the work that we do daily?
Well, I think that people just need to reflect on kind of what roles they want to play. I think you have to come alive and be who you were meant to be. But I'll maybe plug that, like, a bias that policy really matters. I think having good policy is a thing that health professionals just don't get involved with enough. And my climate work, I've just realized and recognized in a lot of ways these policies that have huge impacts on my patients. Often there's not a health voice at the table, and it's not even deliberated on. And so I don't mean to say that everyone needs to get involved in policy. I don't mean that, but I think that we have a tremendous opportunity to shape policy, because we have this unique ability to tell the story of our patients. I feel this responsibility that all these people are coming to me in my primary care clinic and telling me about their lives. I get this unique insight in the way that people live and the harm that happens in their lives, and their joys and their tragedies, all of it. And what happens is definitely that you synthesize these stories to understand broader social factors and societal themes. And so that puts us in a position where we can explain to people what we're seeing, and explain what the solutions are. I'm also just very solutions oriented, and I want to, I think human beings are actually remarkable. I think human beings are capable of so much, that we have the ability, we have the knowledge of how to build a better world. But we've got to create organizing principles where we're just committed, in everything we do to build that. So anyway, I think a well-designed policy for specific issues offers a great opportunity for some important solutions.
you. And now let's move on to some other more maybe personal topics. And I would like to ask you, is there any book that you have read recently or that you know about that relates to this health equity or health activism work that you would recommend people to look for and to read?
Yeah, I the first one that comes to my mind is, I think in times in which I'm feeling so daunted and overwhelmed and angry, that our problems are so big and we're not able to face them and confront them and address them. I was reading stuff by like Mandela, a few months ago, and like that, it really helped me just because of the depth of wisdom, of course, and the brilliance. But just to anchor in an understanding that pain has been such a foundational part of the human experience throughout our history as a species, and that this fight for justice, this fight for alleviating suffering and caring for one another has taken different forms in different times. And that I just, you could feel the ties between the work of decades ago, 100 years ago, different movements that were working to make change. And there are some timeless lessons in those things. The issues may change, the urgency of different issues may change. But I think mindful practice, there's books in mindfulness and things like that have actually really helped me, I think, ground myself and just make me appreciate that I'm a tiny, 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 tiny little flick in the universe, and that connecting to a bigger source of like how we can build solidarity together is such a critical way to build the world that we want.
Totally. Now, I'm wondering, after listening to these last comments, is there anyone that you admire that maybe you could say that it could be like a hero for you, that you would love to, if you had the possibility of just taking a decision and saying, I will have a cup of tea or a cup of coffee with dead or alive, anyone,
Yeah.
who would that be?
Well, my answer is probably not so unique, but I think this folks who have done freedom movement work, whether it's Gandhi or King or Mandela, like there's a depth of groundedness, I think, to their vision, the way that they're able to hold the pain and appreciate it's all around, and have such clarity of purpose, that there's like universal themes applied in specific situations to call out structural injustices. There's just such a clarity of where they want to go, an analysis of what is happening, a depth of wisdom and a depth of spirit, right? I'll say all three.
Amazing. Okay. And now one of those three that you mentioned, Dr. King, he talked a lot about power and about power being that ability to achieving purpose, to achieving things. And he also has one of his most famous speeches, I Have a Dream. I would like to ask you, Doctor, which kind of dream could you share with us about how the world could be on the health equity, on the health justice arena in the coming years? How would that dream look like?
I mean, I want everyone to feel power, to have power, to be enabled so they can manifest themselves, their light. Like, I think that we all have light. We all have special things to bring to the world, and a vibrant world, a vibrant planet requires that we nurture and honor the depth and the beauty of each human being, and that we put all the foundations in place so people can thrive. And that I don't feel naive about that. I'm like positive we have the ability to do that we have the resources, abilities to make the social systems and social services we need so that people can be educated, healthy, fulfill their pathways, be curious about who they want to be, that we have cultural norms and expectations and social contracts with one another, that we honor, who people are and the diversity of people that come together. And so, I think health equity, health again is like at the core for me, because it is about humanity. And at the same time, health is just so intertwined with everything of how we create a society, that I think we should embrace the bigness of those challenges. Because the beautiful thing is, when you embrace the bigness, you embrace the depth of the work of you nurture the roots of all of this, so many things get better at once. And I think that's what's really brought me into climate change. Is if we invest into our planet, if we nurture, if we stop burning fossil fuels, if we stop cutting down deforestation, through these critical forests we have, the world can thrive, the planet can thrive, health has extraordinary benefits for that. And so, it speaks to our interconnectedness, that we invest into everyone, we honor everyone, and we find joy out of seeing people empowered. And that's not a zero-sum game in which someone gets something so I don't. It's that I benefit from you thriving, and I think that's just really true. And that's, I think, the principles in which we can create health equity.
Yes, I agree. I agree with you. And my last question, Doctor, is, you know that we are currently launching a new program at People Power Health called the Health Equity Activism and Reflection Training, HEART. And it's a program that is aiming to increase the impact of clinician-led health equity activism through community organizing. What will you share with the people that will look at this interview, at this video, about the importance of those topics?
I think that health, again, I've said this so many times, I guess, but this is really about taking care of one another. And part of that is taking care of yourself. Part of that is knowing that, we have to be in community. If we're going to take on these big problems, we got to know when to show up and step up and speak up. We have to know when to take a break and to rest and to heal. And I trust and believe in this idea that if we can really look one another in the eyes and trust one another, respect one another, support one another, that those are the interlockings, those deep relationships, build community and then ultimately build power that give us, this potent thing that can speak to these injustices that we often face. And that I have a lot of trust in that, so I'm excited. I'm excited to see this program launch, because and I appreciate also that there's a reflection piece. There's a real praxis there, act and reflect and continue to journey. Is that we're all flawed and imperfect and unsure of all the answers at any given time, but in deliberation and reflection and community building, we can learn and grow and support one another, so that we can get a little closer to our ability, our potential as a society and our better truths. And so I think these kind of trainings are really critical, so that we put the right foundations in place so that we can catapult for action. So I think, there's the adage of if you want to go fast, go by yourself. If you want to go far, go with others, and I think that's a critical piece.
Thank you very much, Doctor, for joining us on these PPH interview sessions. Thank you for your time. And we thank everyone that takes the time to see and to watch the interview. And we hope that you will be able to join us in this journey toward health equity. Thank you.
Thank you.